What if the one place you go to wash away the stresses of the day, to find a moment of peace and solitude, was quietly, invisibly setting the stage for a neurological catastrophe? We think of our daily shower as a harmless ritual, a non-negotiable part of our routine. It wakes us up, it calms us down, it cleanses us. But within this simple act lie hidden dangers, particularly for those of us in the second half of life. Dangers that can elevate your risk of a stroke, sometimes literally overnight. You might have felt it yourself, a fleeting moment of dizziness as you step out of the warm water, a brief sense of lightheadedness you dismiss as standing up too quickly or simply being tired. We've become experts at explaining away our body's subtle signals, brushing them aside as just another part of getting older. But these signals are not random. They are often precise communications from a body under stress, and ignoring them can have devastating consequences. The truth is, how and when you shower can dramatically influence your cardiovascular stability and brain health. Certain common habits, things millions of people do every single day without a second thought, can create the perfect storm for a stroke by causing dangerous swings in blood pressure, altering blood flow to the brain, and even contributing to the formation of blood clots. It is a shocking reality, but one we must face with open eyes and clear understanding, because knowledge is the first step toward prevention. It is about transforming a routine that carries silent risks into a ritual that actively protects your health. I am Dr. Lucas Mason, and in my more than 30 years of caring for patients who have suffered neurological events like strokes, I have seen how the smallest, seemingly insignificant lifestyle habits can culminate in life-altering outcomes. I've sat with families, piecing together the timeline leading up to a stroke, and too often we find clues hidden in the most mundane daily activities. My goal is not to frighten you, but to empower you, to give you the information you need to safeguard your most precious asset, your brain. Before continuing, if you haven't subscribed yet, click the bell icon so you don't miss out on any health tips designed especially for you. If you like the video, give it a thumbs up and leave a comment. If not, give it a thumbs down to help us improve. Let us begin with the very first action of your day. The alarm goes off, you swing your legs out of bed, and you head straight for the shower to wake yourself up. This is where the first major risk lies, in what I call the morning temperature shock. When you first wake up, your body is in a state of transition. Your circulatory system, after hours of rest, is just beginning to readjust to the demands of being upright and active. Your blood pressure naturally follows a circadian rhythm, starting to rise just before you awaken to prepare you for the day. Now imagine introducing an extreme temperature change into this delicate process. Let's talk about the hot shower first. Stepping into a steaming hot shower feels wonderful, especially on a chilly morning. But that intense heat causes something called vasodilation. It is a fancy term for your blood vessels, especially the ones near the surface of your skin, opening up and widening very rapidly. Think of it like a network of tiny hoses all suddenly expanding. This creates more space for your blood to flow into, and the immediate effect is a sudden drop in your overall blood pressure. For a young, healthy person, the body can compensate for this quickly, but for an older adult whose blood vessels may be less elastic and whose cardiovascular system may not be as responsive, this sudden drop can be dangerous. Your heart has to work much harder to pump blood upwards to the brain against this new, low-pressure environment. If it can't keep up, the brain is momentarily deprived of the oxygen and nutrients it needs. That feeling of lightheadedness or seeing spots is a direct sign of this temporary cerebral hypoperfusion. It is your brain telling you it is not getting enough blood. This state creates a volatile environment where the risk of fainting and falling is high, but it also puts immense stress on your entire system, potentially triggering a cardiovascular event. Now, on the other side of the coin is the sudden cold shower. Some people swear by it for its invigorating effects. And while there are certain therapeutic benefits to cold exposure, for an older adult in the morning, it can be just as risky, if not more so. A blast of cold water triggers the opposite reaction: vasoconstriction. Those blood vessels clamp down and narrow instantly. This is your body's cold shock response, a primitive survival mechanism designed to conserve core body heat. But the consequence of all those hoses suddenly squeezing shut is a dramatic and rapid spike in blood pressure. Your heart is now forced to pump blood through a much narrower system, which sends your blood pressure soaring. If you have any underlying hypertension, atherosclerosis, or a weak spot in an artery, this sudden intense pressure can be the very thing that causes a plaque to rupture or a vessel in the brain to burst, leading to a hemorrhagic stroke. So whether you choose scalding hot or icy cold right after waking, you are essentially playing Russian roulette with your blood pressure. You are taking a system that is in a delicate state of recalibration and subjecting it to an extreme shock, forcing it to react in a way that can place your brain in direct peril. Have you ever felt that dizzy sensation in a hot shower or a gasp for breath in a cold one? That's your body waving a red flag. The safe approach is to give your body time to wake up. Don't rush from bed to shower. Allow yourself at least 30 minutes to an hour. Let your blood pressure stabilize. And when you do shower, use lukewarm water, a gentle, neutral temperature that cleanses without shocking your system into a state of emergency. This simple change alone can dramatically reduce the risk you face in that first hour of your day. Next, let us discuss another critical timing mistake: showering immediately after a meal. We've all done it. You finish a nice lunch or dinner, and you want to freshen up before heading out or settling down for the evening. It seems perfectly logical, but from a physiological standpoint, it's one of the most inadvisable times to take a hot shower. To understand why, you need to think of your blood as a limited resource. Your body contains a finite amount of it, and your internal systems are constantly directing its flow to where it's needed most. After you eat a meal, your digestive system kicks in a high gear. The stomach and intestines require a massive amount of blood flow to break down food, absorb nutrients, and move everything along. Your body intelligently diverts a significant portion of your circulation to your gut to power this complex process. This is why you sometimes feel a bit sluggish or sleepy after a big meal. Your body is concentrating its energy on digestion. Now, what happens when you introduce a hot shower into this equation? As we discussed, the heat causes vasodilation, pulling a large volume of blood toward your skin to dissipate the heat. You have now created a crisis of resource allocation. Your body is trying to send blood to two different, competing destinations simultaneously: your digestive system and your skin. And who is the loser in this battle for blood? Your brain. With blood being heavily routed to both the gut and the skin, the amount available for your brain can drop significantly. This diversion of crucial blood flow can lead to cerebral insufficiency, causing dizziness, confusion, And in a worst-case scenario, it can contribute to the formation of a blood clot. When blood flow to the brain slows down, it can become stagnant, making it easier for clots to form, which is the mechanism behind an ischemic stroke, the most common type. This risk is compounded by another factor: prolonged standing in hot water. The longer you stand in a hot shower, the more gravity works against you. Blood begins to pool in your lower extremities. This further reduces the volume of blood returning to the heart to be pumped to the brain. Furthermore, the heat and potential dehydration from the steam can actually increase blood viscosity, meaning your blood becomes slightly thicker and sludgier. Thicker blood, pooled blood, and reduced overall flow to the brain is a treacherous combination. It's creating an environment that is highly conducive to a stroke. I once had a patient, a gentleman in his early 70s named Arthur. He had a very predictable routine: a large dinner at 6 p.m. followed by a long, hot shower at 7 p.m. to relax his muscles. He came to see me after experiencing what he described as a grayout in the shower. His vision went dim, and he felt profoundly weak, having to brace himself against the wall. We ran a series of tests, and while he hadn't had a major stroke, he had all the markers of a transient ischemic attack, or TIA. We pinpointed his post-dinner shower habit as the primary trigger. By simply changing his routine, waiting at least 90 minutes to 2 hours after eating before showering, and using lukewarm water for a shorter duration, his symptoms completely vanished. His story is a powerful testament to how this simple timing adjustment can be a brain-saving decision. So give your body the time it needs to perform the vital task of digestion. Let that process complete before you introduce the demands of a hot shower. Your brain will thank you for it. Beyond the physiological risks of temperature and timing, there is a mechanical risk that many people are completely unaware of. It happens during one of the most common actions in the shower: washing your hair. Specifically, it involves the way you tilt your head backward under the water stream. While it may feel like a natural position, for some individuals, especially as we age, this extreme hyperextension of the neck can compress the vertebral arteries. These two arteries run up through your cervical spine at the back of your neck and are major conduits of blood to the posterior part of your brain, which controls vision, balance, and coordination. Think of these arteries as delicate fuel lines. When you tilt your head far back, you can effectively kink them, just like kinking a garden hose. This can reduce or even momentarily cut off blood flow. In the medical community, this phenomenon is sometimes referred to as beauty parlor stroke syndrome, as it was first observed in people who had their necks extended backward over a sink for a long period during a shampoo. But it can just as easily happen in your own shower. As we age, we are more susceptible to this due to conditions like arthritis in the neck or atherosclerosis, which is the hardening and narrowing of the arteries. An artery that is already narrowed by plaque is much more easily compressed. When the blood flow through these arteries is compromised, it can lead to symptoms like vertigo, dizziness, blurred vision, and unsteadiness. In more severe cases, it can dislodge a piece of plaque, which then travels to the brain and causes a full-blown stroke. Do you ever feel dizzy or off balance when you tilt your head back to rinse your hair? Do not dismiss this. It is a significant warning sign that you may be compressing these vital arteries. You might not even realize you're doing it. For years, you've washed your hair the same way, and it's never been a problem. But the body changes. Your arteries become less forgiving, your neck less flexible, A habit that was once benign can become actively dangerous. The solution here is straightforward and requires a conscious change in your technique. Instead of tilting your head all the way back, try to keep your neck in a more neutral position. You can either tilt your head forward and let the water run over it that way, or just tilt it slightly to the side to rinse. It may feel awkward at first, but it avoids that dangerous hyperextension. Investing in a handheld shower head is an excellent solution. It gives you complete control over the water stream, allowing you to rinse your hair thoroughly while keeping your head and neck in a safe, stable position. It may seem like a small adjustment, but protecting the integrity of those two vertebral arteries is absolutely critical for brain health. This isn't about creating fear around washing your hair. It's about introducing a mindful awareness into the process. It's about recognizing that our bodies require more gentle care as we get older and adapting our routines to honor that need. This is a perfect example of how a small, proactive change can neutralize a hidden, serious risk. Now let's turn our attention to the end of the day. For many, a shower before bed is a cherished ritual to unwind and prepare for sleep. But showering too late at night, particularly with hot water, can interfere with your body's natural physiological rhythms in a way that can be detrimental to your health. Your body operates on a 24-hour internal clock, known as the circadian rhythm. This rhythm governs nearly every process, including your sleep-wake cycle, hormone release, and, crucially, your body temperature and blood pressure. In the hours leading up to sleep, your body is programmed to cool down. This drop in core body temperature is a powerful signal to the brain that it's time to produce melatonin and initiate sleep. A late-night hot shower does the exact opposite. It artificially raises your core body temperature. This sends a confusing, contradictory signal to your brain. Instead of preparing for rest, your body is now working to cool itself down, a process that can delay the onset of sleep and lead to a more fragmented, less restorative night's rest. But the impact goes beyond just sleep quality. Poor sleep is, in itself, a significant risk factor for stroke. During deep sleep, your blood pressure naturally dips, giving your heart and blood vessels a much-needed period of rest. This is known as nocturnal dipping. When you disrupt your circadian rhythm with a late-night shower, you can interfere with this vital process. Your body temperature is elevated, your heart rate may be up, and your system is in a state of alert rather than a state of rest. This can prevent that healthy dip in blood pressure from occurring. Consistently high blood pressure throughout the night puts a continuous strain on your arteries and is a well-established risk for both ischemic and hemorrhagic strokes. You are essentially robbing your cardiovascular system of its nightly recovery period. Think about it. The time when your body is supposed to be healing and repairing is now a time of subtle, sustained stress. This disruption isn't just about feeling a little restless. It's about altering the fundamental biological processes that protects your brain while you sleep. The risk is that a stroke could be triggered during the night, and you might not even be aware of it until you wake up in the morning with symptoms. If you enjoy an evening shower, the key is timing. Try to take it at least 90 minutes to 2 hours before your intended bedtime. This gives your body enough time to cool back down, allowing the natural drop in core temperature to proceed as it should, signaling to your brain that it's time for restful sleep. Using lukewarm water instead of hot can also lessen the disruptive impact. This isn't about sacrificing your relaxing evening ritual. It's about synchronizing it with your body's innate wisdom, ensuring that your path to sleep is one that promotes true restoration and protection, rather than one that introduces silent nocturnal risks. Finally, and perhaps most importantly, we need to talk about what happens after your shower. This isn't a habit, but rather a critical response to a warning sign that far too many people ignore. I'm talking about the experience of dizziness, lightheadedness, numbness, tingling, or sudden weakness after you've stepped out of the shower. As I mentioned earlier, we often brush these feelings aside. We blame the heat, the steam, or standing for a while. But I am here to tell you, with all the seriousness I can convey as a physician, you must not ignore these symptoms. These sensations can be the telltale signs of a transient ischemic attack, or TIA. A TIA is often called a mini-stroke, but this name is dangerously misleading. A TIA is not mini in its significance. It is a major neurological event. It occurs when a blood clot temporarily blocks an artery in the brain. The symptoms are the same as a full-stroke dizziness, loss of balance, weakness or numbness on one side of the body, vision problems, trouble speaking. But they are temporary, usually resolving within a few minutes to an hour as the clot dissolves or dislodges on its own. The shower environment, with its potential for blood pressure drops and changes in blood flow, can be a common trigger for a TIA in a person who has underlying risk factors. That post-shower dizziness might be the only evidence that it happened. The immense danger of a TIA is that it is the single most powerful predictor of a major debilitating stroke. Up to a third of people who have a TIA will go on to have a full stroke within a year, with many of them occurring within the first few days or weeks. A TIA is not a false alarm. It is the final, urgent warning call from your brain. It's your body screaming that there is an underlying problem, a source of clots in the heart, a severely narrowed artery in the neck that needs immediate medical attention. Dismissing post-shower dizziness as nothing is like hearing a smoke alarm and going back to sleep. You are ignoring a direct threat to your life and your future independence. If you ever experience these symptoms after a shower, you need to treat it as a medical emergency. Sit down immediately to avoid falling. Once the episode passes, you must contact your doctor or seek urgent medical evaluation. Don't wait to see if it happens again. The goal of modern stroke neurology is prevention, and a TIA gives us the ultimate opportunity to intervene before a permanent, devastating stroke occurs. We can perform tests to find the cause of the TIA and start treatments, medications, lifestyle changes, or procedures that can dramatically reduce your risk of a future stroke. Please listen to your body's whispers before they become screams. That brief spell of dizziness is not a sign of aging. It is a critical piece of diagnostic information that could save your brain. So, as we conclude, let's bring all of this together. The purpose of this discussion has not been to make you afraid of your bathroom, but to transform it into a place of conscious self-care. It's about understanding that as we age, our bodies require a more thoughtful approach to our daily routines. Let us quickly summarize the safe and simple adjustments you can make. First, avoid showering immediately upon waking. Give your body at least 30 minutes to stabilize. Second, always use lukewarm water. Avoid the extremes of hot and cold that shock your cardiovascular system. Third, wait at least 90 minutes after a meal before showering to allow for proper digestion without competing for blood flow. Fourth, be mindful of your neck. Avoid tilting your head far backward when washing your hair. Consider a handheld shower head for better control. Fifth, time your evening showers to be at least 2 hours before bed to support your body's natural sleep rhythm. And finally, the most crucial point of all, Never, ever ignore post-shower dizziness, weakness, or numbness. Treat it as the urgent warning sign it is and seek medical advice immediately. My final piece of advice is this: learn to listen. Learn to listen to the subtle language of your body. Our modern lives teach us to push through, to ignore discomfort, to explain away the small signals. But true health and wellness come from a partnership with your body, one built on respect and attentiveness. Your body is constantly communicating with you. By making these small, mindful changes to your daily shower routine, you are not just reducing your stroke risk. You are telling your body that you are listening. You are honoring its needs. You are taking an active role in your own well-being, turning a simple daily act of cleansing into a powerful daily act of protection for your brain. Thank you for your time. Be well and be mindful.